Kidney cancer is a silent threat that affects millions of people worldwide. If you want to understand the ins and outs of this formidable disease, from risk factors to early detection and beyond, you are in the right place. The most common type of kidney cancer is renal cell carcinoma, RCC, which accounts for 90% of all kidney cancers. RCC originates in the cells lining the small tubes in the kidney, called tubules, that filter waste products from the blood and make urine. RCC can grow and spread to other parts of the body, including nearby lymph nodes and distant organs, such as the lungs, bones, or liver. Kidney cancer can be classified into 4 stages, designated as stage 1, 2, 3, and 4. The staging process involves evaluating several factors, such as the tumor's size, location, and whether it has spread to nearby lymph nodes or other organs. Overall, it can be classified by stage, cell type, grade, or genetic mutation. The classification of kidney cancer can help doctors determine the best course of treatment and predict the prognosis for the patient. There are several subtypes of RCC, including clear cell renal cell carcinoma, papillary renal cell carcinoma, and chromophobe renal cell carcinoma. Less common types of kidney cancer include transitional cell carcinoma, Wilms tumor, which mainly affects children, and renal sarcoma. Each subtype has unique characteristics and genetic profiles that can help affect how the cancer behaves and responds to treatment. It's important to identify the specific type of kidney cancer to determine the best treatment approach and predict the outlook or prognosis of the disease. There are several known risk factors for kidney cancer, including age. Kidney cancer is more common in people over the age of 60. Gender. Men are more likely to develop kidney cancer than women. According to the American Cancer Society, the lifetime risk of developing kidney cancer is about 1 in 63 for men and 1 in 95 for women. The reason for this gender difference is not entirely clear, but it may be related to hormonal or genetic factors. However, it is important to note that anyone, regardless of age, can develop kidney cancer. Smoking. Tobacco is a significant risk factor for kidney cancer, with smokers having a higher risk than non-smokers. Obesity. People who are overweight or obese are at an increased risk of developing kidney cancer. High blood pressure. Individuals with hypertension have a higher risk of developing kidney cancer. Family history. People with a family history of kidney cancer have a higher risk of developing the disease. Genetic factors. Certain inherited genetic conditions, such as von Hippel-Lindau (VHL) syndrome or hereditary papillary renal cell carcinoma (HPRCC), can increase the risk of kidney cancer. Exposure to certain substances. Exposure to certain chemicals, such as asbestos, cadmium, or organic solvents, may increase the risk of kidney cancer. Chronic kidney disease. People with chronic kidney disease have an increased risk of developing kidney cancer. It's important to note that having one of these risk factors doesn't mean that an individual will develop kidney cancer, and some people who develop kidney cancer don't have any of these risk factors. However, knowing your risk factor can help you make an informed decision about your lifestyle and healthcare. The symptoms of kidney cancer can vary depending on the stage and location of the cancer. In the early stages, kidney cancer may not cause any symptoms and is often detected incidentally during a routine medical exam or imaging test. However, as the cancer grows, it may cause the following symptoms. Blood in urine, hematuria. This is the most common symptom of kidney cancer. Blood may make urine appear pink, red, or brown. Pain in the side or lower back. Kidney cancer can cause pain in the side or lower back that doesn't go away. Unexplained weight loss. If you lose weight without trying, it could be a sign of kidney cancer. Fatigue. Feeling tired or weak for no apparent reason could be a sign of kidney cancer. Fever. A fever that doesn't go away and has no apparent cause could be a sign of kidney cancer. Swelling in the legs or ankles. kidney cancer can cause swelling in the legs or ankles due to the buildup of fluid. It's important to note that these symptoms can be caused by other conditions as well. And having these symptoms doesn't necessarily mean that you have kidney cancer. However, if you experience any of these symptoms, especially blood in the urine, you should see a doctor for evaluation. The diagnosis of kidney cancer typically involves several steps, including medical history and physical exam. Your doctor will ask about your symptoms, medical history, and family history of cancer. They will also perform a physical exam to check any signs of kidney cancer. Imaging tests. Imaging tests such as CT scans, MRIs, and ultrasounds can help detect the presence and location of kidney tumors. Biopsy. In some cases, a biopsy may be necessary to confirm the diagnosis of kidney cancer. During the biopsy, a small portion of the tissue is removed from the kidney and examined under a microscope. Blood and urine tests. Blood and urine tests can help evaluate kidney function and detect any abnormalities that may be associated with kidney cancer. Once a diagnosis of kidney cancer is confirmed, additional tests may be performed to determine the stage and extent of the cancer. This information is used to develop an appropriate treatment plan. It's important to see a doctor if you experience any symptoms or have any concerns about your risk of developing kidney cancer. The treatment for kidney cancer depends on several factors, including the stage and extent of the cancer, the person's overall health, and their preferences. The main treatments for kidney cancer are surgery. Surgery is the most common treatment for kidney cancer. The goal of surgery is to remove the tumor and any surrounding tissues that may contain cancer cells. In some cases, a surgical procedure called nephrectomy may be necessary to remove the entire kidney. Radiation therapy. Radiation therapy uses high-energy X-rays or other types of radiation to kill cancer cells. It may be used before surgery to shrink the tumor or after surgery to kill any remaining cancer cells. Targeted therapy. Targeted therapy is a type of treatment that uses drugs to target specific genes or proteins that are involved in the growth and spread of cancer cells. Immunotherapy. Immunotherapy is a type of treatment that uses the body's immune system to fight cancer cells. It works by boosting the immune system's ability to recognize and attack cancer cells. Cryotherapy and radiofrequency ablation. These are less common treatments that involve using extreme cold or heat to destroy cancer cells. The choice of treatment depends on various factors, and your doctor will work with you to develop a plan that's right for you. In some cases, a combination of treatments may be used to develop the best possible outcome. It's important to discuss the potential benefits and risks of each treatment option with your doctor. The prognosis for kidney cancer depends on several factors, including the stage and grade of the cancer, as well as the person's overall health and other medical conditions. In general, if kidney cancer is diagnosed and treated in the early stages, the prognosis is typically good, with a 5-year survival rate of around 75 to 95%. However, if the cancer has spread to other parts of the body or is at a more advanced stage, the prognosis may be less favorable. In these cases, treatment may focus on managing symptoms and improving quality of life rather than curing the cancer. It's important to remember that every person's experience with kidney cancer is unique, and prognosis can vary widely depending on individual factors. Your doctor can provide more specific information about your prognosis based on the details of your diagnosis and treatment plan. It's important to consult a qualified healthcare professional for accurate diagnosis, treatment options, and personalized medical advice if you suspect you may have kidney cancer or have concerns about your kidney health. With early detection and appropriate treatment, many people are successfully able to manage their kidney cancer and go on to live full and healthy lives. If you guys liked this video and got value out of it, give it a thumbs up, consider subscribing, check out some other videos that I got on my channel, and I hope to see you guys in the next video. Thanks for your time.